Today we are going to talk about renal function test. Why we do renal function test? To detect renal damage and etiology, that is to make the diagnosis, monitor function of the damage, so that is for prognostic purpose, to determine the etiology for management purpose, to find out the severity of the damage. It is also utilized to find out the dysfunction of the kidney in a very early stage and to plan out the replacement therapy in an advanced disease where CKD is in stage 5. If GFR is determined, eGFR is determined, then you can decide even the doses of drugs which are nephrotoxic. Now, indications in which we do renal functions: any symptom sign suggestive of a renal disease, secondary hypertension, young hypertension, chronic anemia, in the person who is having shock, septicemia, diabetes, hypertension, complicated UTI, because that will give rise to a cause called AKI or CKD, electrolyte imbalance, acid-base imbalance, person who is having a symptoms of upper urinary tract or lower urinary tract or obstructive symptoms, person with an autoimmune disease like RA, SLE, rheumatic fever, preoperative person who is on a NSAID or nephrotoxic drugs which can produce a renal damage. In that also we do renal functions. What are the renal functions? What we do? That is urine analysis, blood examination. Blood examination will include blood urea creatinine, which is very useful in AKI. It is also done in CKD, and in CKD other tests like uric acid, serum protein, calcium, phosphorus, alkaline phosphatase, parathormone, those are useful. CBC is useful. Antibody is done usually in case of glomerular disorders. Radiological investigation like KUB, IVP, pre-renal angiography, CT scan, MRI, CT angio, MRI angio, those are being done. Abdominal ultrasound is the most non-invasive technique which gives you a lot of idea regarding renal anatomy. Doppler study will be very useful for finding out the renal artery stenosis. Renal biopsy is done mainly in case of a AKI, particularly to rule out glomerulonephritis and in a case of nephrotic syndrome. GFR and clearance test are useful for finding out the function of the kidney, which will help you for monitoring and for dose adjustment. Cystoscopy will be useful. Cystoscopy, urodynamics, and cystourography will be very, very useful in case of an obstructive uropathy. Perrectal ultrasound is very useful in case of a prostatic disorders and urethra. Laparoscopy is done in case of other disorders. Radiological investigation, which can include the plain X-rays, IVP, ultrasound, compound